This video will show you how to obtain venous blood with the butterfly needle method. Introduce yourself and identify the patient. Explain the rationale for performing the procedure. See if the patient has any questions or concerns. Wash your hands. Make sure that all items needed are assembled on a flat, stable surface next to your patient. For needle assembly, secure a needle onto the vacutainer holder by screwing the grooved end of the needle into the grooved tip of the vacutainer holder and turning the holder in a clockwise motion. Make sure your items are located on the opposite side of your dominant hand. For example, if you're right-handed and will be using your right hand to draw the blood, you want to make sure that your table is set up on the left side of you so your left hand can easily grab safely and quickly the items that you will need to perform the procedure. To assist with vein selection, apply the tourniquet to the patient's arm. Typically, this is done about 3 inches above the needle insertion site. Explain to the patient that the tourniquet may be a little tight, but it is only temporary. There are several ways to tie a tourniquet. My best advice is practice makes perfect. Do not allow the tourniquet to stay on your patient for more than 2 minutes. Select a vein that can be palpated. Veins should feel spongy. Apply gloves. Clean the site lightly in a circular motion, going from the inside to the outside with an alcohol prep pad and let it air dry. Ask the patient to make a fist and hold it until you say to release it. Remove the needle guard and quickly insert the butterfly needle into the vein. If drawing from the hand, use a 5 to 10 degree angle. If drawing from the antecubital, use a 15 to 30 degree angle. You can choose to hold both wings together, or hold the body of the needle, or you can also just hold one wing of the needle. If the needle is in the vein, you will see a flash of blood in the tubing. If using the vacutainer method, press the appropriate tube into the needle inside the vacutainer holder until the blood starts to flow. Switch tubes as needed. Continue to check in and talk to your patient to make sure they are okay. If you are using the syringe method, you would want to make sure that the needle was secured directly to the syringe and then all the air was pushed out of the syringe before using it to draw blood. If using the syringe, you would pull back on the plunger of the syringe slowly until an adequate amount of blood is obtained, and then ask the patient to release the fist. Remember TTN, tourniquet, tube, needle. Release the tourniquet, remove the tube, and withdraw the needle. Invert the tubes as recommended. Ask the patient to assist by applying gentle pressure over the site with gauze. Retract the needle or activate the safety lock on the needle and place it into the sharps container. Make sure your patient is feeling okay and then apply a bandage to the site. If a syringe was used, attach a blood transfer device to the syringe and allow the blood to transfer using the tube's vacuum. Do not depress the plunger of the syringe. Fill the tubes with blood from the syringe according to the correct order of draw. Blood smears should be made at this time if needed. Make sure to label all required specimen tubes and complete a lab request form. Check that the patient feels well. When completed, remove gloves, wash hands, and make sure to record the procedure in the logbook and on the patient's medical chart.